I made my salary. So malpractice. Why you need malpractice? Because the healthcare in USA is highly litigious. They're ready to sue you. All the patients are highly educated and you can't please everybody. And it's very litigious atmosphere there. Number 3, your best friend is the nurse. There is a hierarchy there. You have to work in the hospital. You have to affiliate yourself with the hospital. So if the nurse is on your side, it makes your life easier. So this is how it goes. In the middle of the night, they call you and it's like, oh, Dr. Mufti, you need to come in. And then they document everything. It's all about documentation. And if I'm 2 minutes late, they will say, oh, we talked to her and she's 2 minutes late. Everything is about documentation. Nurses can make or break your life there. If you don't accept a certain kind of insurance, you're not going to get paid. I know the system here is different. You get paid for your services. Maybe you take cash even before you see the patient. It doesn't work like that. If you're working in the hospital, you have to see the patient. You cannot say no. So it's not always all about the money. And then, the one thing which I hate, you can never be famous in US. You cannot be famous unless you're in academics, unless you're in research, or you put the big heart into something which failed recently, but that's the only way to be, gain the fame. So there is no fame for you. You can be the bestest of the doctors, but there is no name. And maybe just few of your colleagues who are in the hospital, they know that you're working and you're a good doctor. It's a word of mouth. And the referral system, your practice depends on that. Otherwise, it's not like here there are billboards and everybody knows that there is an IVF doctor, Dr. Rashid Latif, or some big name, and you go and seek your health from there. So healthcare system is a little bit different. But if you're looking for the higher education, you want to have the bestest of opportunities. You want to work for the merit and you want to be rewarded for what you are doing. Regardless of the money will be the consequence of what you are doing, and especially if you go to the remote areas, the cost of living is low and the money is higher, you can make a lot of money. But if you're just looking for the best equipped medical healthcare, like robotic surgery, minimally invasive surgeries, like there's so many things which are coming, you want to learn that, then that's the way to go. And so many people after learning and practicing in US can always come back and they can serve the country, or they can stay there depending on their marital status and the dynamics of life. So there are plus and minus. Some people are sitting on the fence, nothing wrong with it. We'll be helping them with the USMLE preparation also. There will be the crash course given. And the students who don't know what they want, I'm just one email away. This email is not right. So I'll get the new email and they can always one-on-one can email